Yeah, blatant disregard for others, right? Does he violate social norms? I would say yes. So I think, at least as a provisional diagnosis, the antisocial personality disorder would be rather high provisionally. Can anybody repeat back to me the 6 things now that we have to consider, that we would need to consider for any personality disorder? Substance induced. All right. So substance induced. What else? Medical condition. So another mood disorder or mental disorder. 3 more. Good. Again, previously these illnesses were diagnosed on what was referred to as the second axis, and there was this belief that that meant they were not as severe as illnesses that were categorized on the first axis, and that's just simply not true. Personality disorders can be just as debilitating, and as axis 1 psychopathology, and at the very least share with axis 1 disorders their impacting functioning. So clinically significant, good. 2 more. Perfect. So it's stable and pervasive. Now, it's hard to say, is there any evidence of any of the above here, because we have such a small snippet. We often talk about what the prequel would show or should show to be consistent with, in this case, the diagnosis of a personality disorder. I guess the easier way to reflect this question is there any evidence in this film that would actually go against antisocial? So is there a pertinent positive that we could say, this is not consistent with what we would expect from any personality disorder, including the antisocial personality?
Maybe that none of the other characters ever thought it could be the bunny, so maybe it wasn't pervasive in all the different settings.
That's perhaps given that they knew of the bunny.
Yeah, if they did.
Right. Okay. So maybe you mean maybe not stable over time. If they knew the bunny for an extended time, the surprise that the bunny would have done this, Boingo would have done this. So maybe there is some evidence that this is not a personality disorder after all. There's one more thing too that's a little concerning to me. Is that right? We'd have to go back and review that. Yeah.
I thought that he lost his job because the thief had taken the recipes from the restaurant or the food stand he was working at. So he had kind of
manipulated that. Yeah. Oh, that would be more consistent with the antisocial personality, not necessarily weighing against it. One more, though. I mean, I think it was the first thing you mentioned in terms of what we have to make sure we rule out. Drugs. Does Boingo look like he's on drugs? Possibly. Like what? Stimulants, right? Yeah. With regard to stimulants, who are some of his friends? Or some of the other characters that we have in this plot? What's the squirrel's name? Anybody? It's kind of telling. Yeah, it is twitchy. What drug are we concerned about here, given the nature of how twitchy acts and his name? Cocaine's a possibility. What's the other one, though? Yeah, caffeine. Yeah, I'm worried about caffeine here. All right. Muscle twitching is actually a diagnostic criteria for caffeine intoxication. Right. The other concern I have is the wolf. We'll get to this later, but there may be evidence of cocaine use disorder in the wolf. We'll get to why in a little bit. But certainly, we're again at this point where we're looking at behavior of Boingo. We're thinking that this might be stimulants versus caffeine. And just like a board question, if caffeine use disorder, or more importantly, caffeine intoxication is answer A, there very frequently, stimulant intoxication may be answer B, and you're gonna have to be able to pick the single best answer. We talked about this just about an hour ago. Anybody remember what are some diagnostic criteria specific to one but not the other? Facial flushing and diuresis. They're the big two. And GI disturbances, right? Versus GI pain, right? Any evidence in diuresis or facial flushing in these characters? I'm trying to figure out what's in these pies. By the way, not to belabor this point for those that were depressed about this, but what might be the type of pie if this were, that is, Hoodwinked, were about caffeine use disorder? Chocolate, right? I mean, a good Boston cream pie, right? We'll get to more about the wolf in just a second, just a little bit. All right, anything else about Boingo? So I'm worried about a substance-induced change or personality change. We always have to investigate and rule out. What I want to do is I want to make sure Boingo has a sustained period of sobriety. And let me see what we're working with before I render a medical opinion on his personality, that is, who this person is, because it might actually be affected by the use of drugs. Any other characters here?
It was mentioned in the movie that he was only stealing like dessert recipes, like sweets, like chocolate. Because when the wolf investigated the tiger, like the guy in the tiger costume, his character was, but he was like a sandwich maker, and then he's like, his face was safe because there was no desserts with just sandwiches. Like an add-on to the caffeine, like the chocolate maybe.
Well, I mean, what do desserts contain that other foods, whether we call them breakfast, lunch, or dinner, usually don't? Sugar. Oh, what's sugar a street name for? Who said it? Cocaine. Yeah. So we're back to cocaine. I actually am very relieved that there was a pause, if not an awkward pause in this room, that the majority of students here did not know that sugar means cocaine in drug slang. That's awesome. Is that? All right. So again, we're back to drugs again, right? And again, cocaine is, or stimulants in general, certainly cocaine, because of street slang, certainly could be a focus of clinical discussion through Hoodwinked. Yep. Other characters? Graham. What's going on, Graham? So I think there's a couple of teaching points here. Anybody have one they want to discuss? Let's say Granny's thrill seeking is clinically significant. So she reports to, or she presents to, the RWJUH emergency department frequently due to multiple sustained injuries as a result of this behavior, to a point where even though her insight is intact and she understands the cause and effect, she is not able to change her behavior. And now she's coming for help. In this case, it may be helpful to formulate what is thrill-seeking behavior and what likely applies here to Granny's specific behaviors that we see. Again, this assumes clinical significance, right? Which in the movie really doesn't, but we have to make this a teaching point. So any ideas? of what we may engage in here. Now, again, I have to say that this is part of psychotherapy. This is not going to be part of the initial psychiatric evaluation, and it is very unlikely to be part of a med check. This is engaging in real psychotherapy with regard to maybe uncovering an answer of what underlies Granny's thrill-seeking behavior.
Like a reward sensation, have like that addiction, like getting that reward.
Good. So I think with regard to the adrenergic surge, which is likely to be dopaminergic or mediated by dopamine in the reward center, specifically, do we know the area of the brain? Louder? Ventral tegmental area? Nucleus accumbens? That is going to explain not only the biological part of the biopsychosocial factors contributing to the behavior, but more specifically, a biological factor contributing to the perpetuation of the behavior, right? Because that biological factor, that dopaminergic surge in the VTA, is going to serve as a significant positive reinforcer, right? And any reinforcer will strengthen a behavior, including strengthening a thrill-seeking behavior. So yes, I do think there's something to that. This is a dopaminergic surge. This is the ventral tegmental area. This is biological, and this is a biological perpetuator. Anything else here? How about a psychological one? Again, you're in psychotherapy. So as a psychotherapist, I don't want to hear about this thing called dopamine. And where the heck is the VTA anyway, right? By the way, you should know where the VTA is for your exam. I'm in character here, right? So if you have an act, if you have a stimulus that you are fearful of, what is the likely behavior that is to result from your fear, from the object of your fear? Avoidance. Avoidance is a defense mechanism, which results in a behavior that bears the same name, right? So the unconscious process of avoidance is what results in the physical observation of avoidance. And that's the finding of phobic behavior, avoidance behavior to the phobic object, whether or not that's hang gliding, rappelling, rock diving, or cliff diving, any or all of the above. Pretty straightforward. So if somebody came in incapacitated due to their fear of blank, that's something you're going to have to address, is the defense mechanism of avoidance. And where's the avoidance coming from? Again, not in the initial psych eval. You can't simply ask a person, where's this avoidance coming from? And let's undo this. It doesn't work like that. But it will be a focus of your psychotherapy, getting at the core and the etiology of the, not the avoidance behavior per se, but the avoidance as a maladaptive defense, right? Then, if that's the case, how can we explain instances in which an individual does have an identified phobic object, but instead of avoiding it, they actually run towards their fear? If it's for sexual pleasure, it could actually be masochistic disorder when clinically significant, but I don't think that's what's going on with Granny. If so, we're taking Little Red Riding Hood to a completely different level. I mean, Red Riding Hood is anthropologically about a young girl coming of age, right? We've seen this written up in multiple contexts, but I've never seen that applied to Granny. It's a little bit more than just controlling. It's actually running towards their fear. And that occurs when avoidance as a subconscious defense is either in series with or substituted by another defense called reaction formation, where the individual will manifest the complete opposite behavior with regard to their subconscious impulse. So the individual behaviorally will manifest as running towards their fear rather than running away from it, right? And this situation, this phenomenon is referred to as counterphobic attitude. So counterphobic attitude is the substitution of reaction information for avoidance, where individuals will run towards their phobic object. Right? So that's a psychological part of the biopsychosocial formulation of what may precipitate a behavior that then becomes perpetuated by the biological factor of dopamine surge in the VTA. That's what's going on with Granny here. Now, again, I said this in 7 minutes or less. We're not going to be able to tell Granny this as part of a mini didactic or a micro didactic and expect her to realize that and say, you know what? I no longer want to hang glide or skydive or any of the above. All right, so that's Granny. What else? Anything else?
What about the goat that helped Red go they find the track and get to Granny? I would say he's like because he's like in isolation and he has that fantasy defense mechanism and also the magical thinking of the witch cursing him, the only singing.
Could be, unless the witch exists, of course. But if there's magical thinking, certainly we see someone with social isolation. This may be schizotypal personality. I'm trying to think of a differential diagnosis here. Again, we always think drugs, we always think medical condition. But outside of that, is this character demonstrating any form of echolalia? Is he singing what's on his mind, or is his singing repeating what others are saying? My take is that he's singing what's on his mind. Right. However, hypothetically, if he were repeating back what others say, albeit in song, then we're looking at a mental status exam finding called echolalia, which itself should be differentiated from echopraxia. Right. So if echolalia is the repeating of, in a clinical setting, the clinician's words, what is echopraxia? Right, mimicking a behavior. Good. Both are considered to be diagnostic criteria for what? And I'll take two answers here. Good, catatonia. Right, both are actually in the DSM definition of catatonia, which itself, as of 2013, is in what chapter of disorders? Psychotic disorders. Catatonia has been moved out and moved into the psychotic disorders chapter in the DSM-5. So a psychotic disorder may also be in the differential diagnosis if we think that this is echolalia, which we probably don't, right? It looks like he might be responding in song through his belief that he's been cursed. Right? So again, in the context of social isolation, maybe the schizotypal personality, which, by the way, is a personality disorder that is both in cluster A as well as column number 1, in that it has a defining cardinal trait: social isolation with magical thinking. Individuals with this condition are often described by others as bizarre. Right? So that's the schizotypal personality. Schizotypal does confer risk, specifically as a predisposer, specifically as a psychological predisposer to schizophrenia and other psychotic disorders. Other characters. Red. What's going on with Red? I will allow you to now kind of extrapolate from other tales depicting Little Red Riding Hood, in as much as we may understand other stories about Little Red Riding Hood.
Anxious features.
How so? What did you see?
She was really concerned about something happening to her granny. She was when she did get to Granny's house,
Yes, this is actually an interesting take. Uh, let's focus on this, pardon the pun, the focus on the hypervigilance. Again, in psychiatry, we've stated this more than once already. There's a fine line between abnormal behavior and abnormal behavior that is clinically significant. And one of the things with regard to hypervigilance is, in this case, the woods, right? The woods, metaphorically, in a lot of different tales, is incredibly symbolic. And I'm sure you can pick out dozens of stories, plays, books, movies, that symbolically look at the woods, the forest. And there's always a harbinger of what is out there, right? It's the trope of the unknown. There is an American tale that focuses on a group that exists on the edge of the woods. That is, the group demonstrates significant group hypervigilance, in so much as that it was a psychological predisposer to a major U.S. event. Any idea of what it refers to? Predisposer, psychological predisposer, community at the edge of the wilderness. It's the Salem witch trials, right? I mean, to live every day with the concern that your village was going to be attacked, you were going to die, was a significant predisposer about what happened when those two little girls, ages 9 and 11, had those quote-unquote hysterical fits, and how a community reacted to that. Right? And that was the precipitant to what became known as the Salem witch trials. And I bring this up not only to draw the parallel between Red's behavior, identified behavior as being hypervigilant, perhaps being culturally sanctioned, but in addition, the idea more concretely that there are witches involved, right? Whether it's a witch's curse in Hoodwinked, or whether it's the actual Salem witch trials itself. There's a parallel there as well. Anything else with Red? If she's demonstrating clinically significant hypervigilance, what is the one thing that, or among others, what one thing would a clinician want to delve into to investigate?
Somebody had excuse me, hypervigilance. I would worry about depression.
Depression?
I worried about anxiety.
Mhm.
I would worry about suicidal ideation. Yeah. Just the lack of, because it's presumed that they have poor impulse control.
Mhm.
I'm assuming because they're so vigilant to what's going on around them, they're so paranoid of what's going on around them, that they might hyper-react to their respondings.
Mhm.
I think you also want to inquire about family history.
Yeah, that's right. Definitely want to inquire about a trauma history. In investigating a potential trauma history, again, it's also very interesting to now go back into the story and the trope of Little Red Riding Hood, and what did this young girl incur and encounter in becoming a woman? And again, that's something more really for the anthropologist than it is the psychiatrist. But that's an interesting take on it. And to the extent that she is hypervigilant, and the extent to which we have to consider post-traumatic stress, we have to consider a trauma. You can't have post-traumatic stress without the trauma. And while Hoodwinked doesn't necessarily go there, certainly other forms of the myth do. Anything else about Red? Any other characters? Let's get back to the wolf for closing comments. Well, what were your thoughts about him? I'm actually really interested to get your gut as to whether or not you believed him from the outset, because I think there's a certain prejudice we have, irrespective of the name. We talked about this with the last group, in as much as the wolf appears in a story called Snow White and Rose Red, and what the wolf symbolizes, again, in anthropology and myth, and certainly in children's tales. So when this wolf professes his innocence in the beginning, did you believe him? Or did you think this was some kind of a ruse to devour? Red. Oh, come on, you had to believe him or not. I mean, you thought it was a ruse? I mean, very few people believe the wolf. I mean, if you believe the wolf every time you hear a wolf talk, you're probably going to be in more trouble than not by reading children's books. Right? So again, there's a certain prejudice we have with regard to certain characters. And in a clinical setting, that's going to exist too. When somebody comes in and there's this term called or documented, the antisocial personality disorder, there's a certain set of features we are getting prepared to interact with over the hour of our psychiatric evaluation. That's called prejudice, right? However, this becomes problematic in the event that the clinician has provided new information, but remains rigid in their prejudice. So the physician's ability to adapt to new information and to change their provisional diagnosis is what makes a doctor, right? And that goes for any doctor. Right? Somebody comes in with substernal chest pain, radiating to their left shoulder. You know, when the cath shows clean arteries, I hope you change your mind. It goes for any doctor. Right, so that does apply here. That applies to our wolf friend, or our wolf-turned friend, if you will. When you do begin to believe him, when it's actually disclosed, anything else you felt towards this character? Sympathy, especially after I called him a coke addict, right? Yeah. So what's going on with that? Why might this character be demonstrative of cocaine as a substance and cocaine use disorder, in particular, cocaine intoxication in particular? So one of the things I'm concerned about is that wolves generally have very poor eyesight, and very little of this movie is portrayed at night, when we know that his acuity would be much better. So if Mr. Wolf presented to you with a chief complaint of blank, and his self-report was primarily during the day, I'm a little concerned that some of the things he'd be reporting to me, like talking to animals, would be a product of his own mind. And it might be the result of poor visual acuity and his misinterpretation of reality, an illusion, if you will. Right? So what differentiates the illusion from the hallucination? Exactly right. Okay? Both are considered perceptual disturbances, and specifically, both are considered to be visual perceptual disturbances. But in one case, the illusion, it's a misinterpretation of a real stimulus. The visual hallucination is not, right? It's not a misinterpretation, because there is no visual stimulus prompting it. It's an internal CNS result only. So I'm a little concerned that he's experiencing perceptual disturbances, and I would guess that initially anyway, provisionally, it might be an illusion with an eye, in as much as it may be compromised or mediated by his poor visual acuity. Most of this story is told during the daylight, when I know the wolf is not seeing well, right? This, in reverse, of course, is not unlike somebody who, when we round on in the morning, tells us that they're seeing things at the side of their bed at 11 or 12 o'clock at night. Do we automatically say that every patient that tells us that is or has schizophrenia? No. Right? There may be other things going on, and certainly we always think of substances, we always think of medical conditions, and even though it's not a discrete medical condition, if there is something that we're concerned about medically, that might be characterized by poor visual acuity, the psychiatrist has to take that into account with regard to the patient's self-report of quote unquote seeing things. Especially when we think it's an illusion, that what they saw the morning after appears to have been the shade or the lamp that they're pointing to in the bedroom now that it's 8 a.m. or 9 a.m. So that might be in part what's going on with this wolf. Right? Again, you may think that rabbits can talk, and you may actually give him a clean bill of health, but I ask you to please put on your psychiatrist hat and think that this may not be grounded in reality. Of course, the fact that the wolf's talking to you is your own problem. There's more to this. Hi. Yeah, please.
But just to sort of build off of the idea that the wolf is nocturnal, and we see him very active throughout the day, and the job that we now know he has requires him to be interacting with people throughout the day. I would wonder if there's some sleep deprivation that may also be contributing to whatever visual hallucinations or illusions he's seeing. He's not able to sleep during the day.
Yeah, and then, a sleep-wake disorder really is at that interface between that which is published in the DSM and that which is actually in the domain of a pulmonologist. So it could be looked at through as either a mental disorder or an organic pathology. Right, so that's something to consider here for the wolf. I totally agree with you. This may be a circadian rhythm disorder, where the wolf is awake during the day and is sleeping at night, which would be the exact opposite for us. We're talking about a non-domesticated dog, right? Cocaine. What if Wolf were in this hospital bed, in this 900-bed hospital? We were rounding on him, and he was telling us that he is seeing little critters. How would you describe the wolf's affect? Blunted? Do you find him horrified that he is actually seeing rabbits and raccoons that are talking? No. Would you then call his affect appropriate or inappropriate? It's inappropriate or incongruent. Incongruent sounds more politically correct. Right? Incongruent. Right? Is there a condition where a person will tell you that A, they have poor visual acuity, number two, that they're seeing objects in the room that are formed, right? These are formed hallucinations. And their affect is incongruent. There's insight that allows for an incongruence and therefore a calm affect in reporting. What is the Charles Bonnet syndrome? Other than being a neurologic disorder in which a person actually tells you that they are seeing things that are formed hallucinations, formed visual hallucinations, for which they have insight into and therefore have an inappropriate or incongruent affect. That's the defining principle of the Charles Bonnet syndrome. There are multiple causes. They do affect not only the eye itself, retina, but even the optic nerve. And one of the things that affects the optic nerve that can result in the Charles Bonnet syndrome is a drug. And guess what drug that is? Cocaine. Describe to me what this wolf is wearing. I mean, again, you got to play part detective being a psychiatrist. What did you see? I don't know if he had glasses on, did he?
Maybe, I don't know. It felt like he was wearing investigators. Is that right?
How about his shirt? There's a scene where he's wearing a Lakers jersey, and there is a straightforward allusion to a 1980s film called Fletch. Anybody pick that up? Of course not, because you're half my age. Okay. Fletch is about, starring Chevy Chase, is about an investigative reporter who goes undercover to reveal a major drug ring. Any idea what drug Fletch uncovers? Cocaine. Right. So, in a somewhat roundabout, perhaps straightforward way, this movie does allude to cocaine. And to the extent that the character's visual acuity formed visual hallucinations and inappropriate / incongruent affect as part of the plot, this may be about Charles Bonnet syndrome. Somebody has to check this for me, but I think Bonnet and bonnet are spelled the same, which is just another twist with regard to Little Red Riding Hood being a bonnet, right? The hood is a bonnet. So, any other thoughts? Wolf, non-wolf, Hoodwinked. Oh, we're good? All right, we're going to sign off here. We're going to ask one team to stick around. For those following at home who are preparing for the case conference, give us 10 minutes to set up. We'll be right back on Zoom. Otherwise, we'll see everybody back hopefully tonight, right? Everybody's got the Zoom link for tonight's special event. If not, back next Friday, and I will tweet next Friday's programming sometime over the weekend.